Health officials say the continuous stigmatization of people living with HIV, tuberculosis, and COVID-19 remain a major barrier to the treatment of these conditions. Although Ghana has chalked some success in the prevention of HIV and tuberculosis, the outbreak of the COVID-19 pandemic presents a new task for health workers to deal with. Stigma, according to health officials at the Komfo Anokye Teaching Hospital, has the tendency to derail the gains made in reducing diseases such as HIV, tuberculosis, and COVID-19, since people with such conditions will be reluctant to visit the hospital for care. Director of Nursing Services, Georgina Efuasam, believes the intervention will serve as a formidable strategy for the prevention of disease.
UNAIDS 1990 Global Aspirational Targets are the expectations that by 2020, 90% of people living with HIV will know their HIV status. 90% of people who know their HIV positive status will be accessing treatment. 90% of people on treatment will have suppressed viral load. As a country, we stand a high chance of achieving these global targets if a comprehensive combination of prevention and promotional strategies are incorporated into the workplace program and effectively implemented. Education at the workplace, therefore, constitutes a formidable strategy for the prevention of the disease. Our meeting here today goes to buttress this point. And this is why about 900 and more staff of Komfo Anokye Teaching Hospital have been trained on stigma and discrimination reduction interventions towards HIV, TB, and even COVID-19 prevention.
The Quality Assurance Unit of Komfo Anokye Teaching Hospital says measures have also been instituted to ensure total enforcement of patients' confidentiality at the facility.
Staff who engage in stigmatization behavior will be taken through corrective procedures, including retraining. They will be mentoring with the champions to know what exactly they are supposed to do. Then, if they persist in stigmatizing clients, they will be given to the HR for other intervention. And further, they are going to have reward system. The reward system could be negative or positive. You will be queried if your behavior have not changed. But if you are really doing it well, making sure your clients are in safe hands and stigma-free process, then you also have a positive award by the management. Then stigma and discrimination monitoring activities will be set up in conjunction with the Quality Assurance Unit. We are going to also improve patients' privacy by provision of curtains, screens, and even if you have to put them in an area that people will not see that client.
The program is sponsored by the Ghana West Africa Program to combat AIDS and STI with funding from the Global Fund. Speaking on behalf of Chief Executive Officer, WAPCA's Project Manager Dominic Adumako says the interventions will also go a long way to ensure the human rights of persons living with HIV and TB are protected.
This launch event today brings further understanding to the works of ensuring persons living with HIV, TB clients, and KPs are no longer a subject to the unfair rigors of SND, sensitize staff to desist from such acts through a litany of activities such as the launch, billboards, SND messages.
The launch was on the theme Zero Stigma at the Center of Excellence.